Hello and welcome to my podcast series, Duty Talk with Dr. Matteo Vigo. In fact, this technique, there is no cutting into the breast tissue. It's absolutely pain-free. It's done under local anesthesia with sedation. Consider this technology is available only for a few doctors in the UAE. I'm one of the first ones to start doing that. Together with Sarah, my personal assistant, you know very well. We won the prize of the top 3 customer service centers in the world. I'm here today with Mariana, which is my social media manager, and she is a person who I invited to have some questions about the new technology, MIA Femtech, because the episode today is all around this kind of topic, which is the new technology for breast enhancement. So Mariana has seen some of the procedures. She helped me to develop a communication strategy to let all the people know about the technology. So if you want to introduce quickly yourself.
I didn't expect that. Okay, yes. Hi, everyone. I'm Mariana. Some of you may know me from the podcast Dubai Talks. Mariana in Dubai is my YouTube channel, but it's all in Italian. So unfortunately, if you don't speak Italian, nothing for you. But here,
we will develop now. You have to develop an English one.
Well, yeah, maybe. This is the first time I'm doing the podcast in English. I'll do my best to ask the questions.
You are perfect, yes.
And I think we can start.
Yes, straight to the point.
Straight to the point. So, MIA is a revolutionary technique. You didn't say this word, so I will bring it up. And it really is. Tell us more about it. What is it? How does it work? What inspired this technique?
So I was recently in Barcelona to the first MIA Worldwide Summit, where all the doctors who are providing this technique came together to discuss and improve the quality of the service we are giving for MIA. The CEO of the company, which is called Establishment Lab, told us a story why he developed this technique. Basically, it was in Japan in 2015. He was seeing women injecting hyaluronic acid in the breast because they didn't want to undergo a full breast augmentation, general anesthesia. So he called his research and development department and said, we need to create an injectable implant. And they said, are you crazy? How can we inject an implant? But they started the process. So in 9 years, they developed the perfect technique. So basically, they create the kind of implant which is stretchable enough to be inserted with a small opening. They developed the tools to create this. And basically, what they wanted to do is to address the problem that a big pool of women have, which is how they deal with the compensatory behaviors for their breasts, which means padded bra, push-up bras, dresses that covers the lack of fullness in the upper pole, etc. These are not patients who are considering breast augmentation. These are patients who are absolutely looking for a little bit of enhancement, a little bit of pumping up and to get rid of this compensatory behavior. They don't want to buy push-up bras. They want to buy a traditional bra. So they developed this technique and they wanted to do in a more natural way. Why? They didn't want to disrupt the breast tissue. In fact, this technique, there is no cutting into the breast tissue. We don't use even a cauterization device because everything is absolutely bloodless. It's absolutely pain-free. It's done under local anesthesia with sedation. That is even the revolution, because patient can walk out and go back to a normal life within 90 minutes. So that's the real revolution.
And that's true. There's no blood. It's a very minimally invasive, as you said. And I think it really is perfect for women that are maybe scared of, the post-op of traditional breast augmentation and also of the procedure. I'm personally scared of general anesthesia, and I've never done it. I never had surgery. Imagine it, I can say something. I also did my nose job with a local anesthesia with one doctor that I think is the only one that does it under local anesthesia because I was scared. So I think there's a lot of women that will be actually, they will be very interested and pleased to hear that there is this technique. And since you mentioned already the tools, and we have them here, please show us these tools, because maybe they will help people understand how is it possible to insert the implant. Did we say from where?
No, we didn't say it. So it's
that.
a 2 centimeter hidden scar in the armpit. So there is no cutting on the breast itself. So that's also very, very interesting, because we have this maybe we can put an image now with a 2 centimeter scar, and after a few months it becomes absolutely invisible. So that's also interesting for the patient itself. So basically what we do, we put some local anesthesia in the tissue. We'll leave it for a few minutes to settle and to completely numb the area. Then we enter with the inserter, which is like basically a similar tool like that, okay, that creates a tunnel from the armpit to the breast. And then we insert this expander, which is folded like that, is inserted in the breast in this way, okay, and with a special pump that is provided in the kit. So the expander is here. We pump it and we basically expand the tissue. So the breast is not cut. There is no cutting whatsoever. There is no blood. The tissue is just expanded. We leave this. We go on the other side. We do the same thing. Once it's done, then we deflate completely the expander, okay, with the reverse pump, okay. We take it out. And then we have this fantastic tool, okay. The tool is a gun, basically. This part is the one which inflates, because once it's inflated, it can push the implant to that. So basically without touching the implant is in this box, we put some antibiotic solution, we suck the implant inside this part, okay. Once the implant is in, we connect this tool, okay, it's locked. We enter from here, we push the button, and the implant is gently pushed through this nozzle and goes in the position that we decided for. The procedure is done. It takes 7 minutes from the moment I create the tunnel to the moment I inject the implant. And there is no pain for the patient. The patient really can go out. We have patient flying the day after. We have patient go back to work the same day. Patient going to the mall the same night of the procedure. There is no discomfort for the patient. The only thing I always tell the patient, you need to take care of your scars, because it's still a scar. There is a little incision. It's in a hidden area. It's a clean area, so it's not a major deal. So at the end of the day, really, the procedure is minimally invasive. There is a reason why we call it that.
It really is.
Yes.
Now, what happens if someone decides to remove the implants?
That is a good question, because the company thought about that as well, and they offer a warranty to the patient. So for the first 2 years, when you put your MIA Femtech implant, you can remove it completely for free. Why they did that? Because they're sure that there is no patient who want to do that. In fact, after I think nowadays we are around 1,800 cases around the world, nobody had to remove it, okay? Because the patients are very happy. The thing is very important is about also the implant itself. We didn't talk about that. The implant is a diamond shape, and it's very small. You can see this is a 100 cc implant, and I never dreamt to insert a 100 cc implant in the breast, because it doesn't give anything. But the diamond shape gives the projection effect on the implant that can really give an amazing outcome to the patient and the volume the patient is looking for. So very, very important, the quality of the implant itself, the design of the implant, and the fact that with a small implant, there is no heaviness on the breast. Patient, after a few weeks, they say that they forget to have done the procedure. They don't think that they have something inside the breast because they don't feel it. It's very soft, it's very comfortable for them and feels part of themselves.
This is so amazing that recently you've also been interviewed by a magazine that here is well
yeah, it's the Harbour Hospital magazine. They made an interview because they wanted to know more about this thing. We can put the link of the review in the description of the article, so you can read it. And really, the interest about the technology is really growing up in the market. Consider this technology is available only for a few doctors in the UAE. We have 3 doctors in the UAE. I'm one of the first ones to start doing that, and I'm very happy because it's a niche technology and should be given only to highly specialized doctors in breast like myself, and I think we will see more and more enhancement of this technology in the future. So we will see really a lot of new tips and tricks that will come up.
And I want to say you're one of the first, but you're also the one with the most experience now, right?
Yes, and the highest number of cases
you
at the
didn't want me to ask
moment.
that is not in the question, but I had to say, yeah, you did a lot of cases in
I've done around 25 cases right now, and all the patients are happy, very, very satisfied with the outcome. And I think more and more patients will come. We need a little bit of word. That's why I'm doing also this, because we need a little bit more word of mouth about MIA, and this will help a lot for women to know that.
Yeah, I think obviously we're doing marketing from your side, but it's still a procedure that it's very new, and a lot of people still don't know about this, and they really need to know, because there are still so many women which are undergoing, the traditional breast augmentation, and they
which is still what is important to understand. This doesn't substitute a traditional breast augmentation. There are cases where the patient wants more volume, which is absolutely fine. I never do like a cup, double D, double F for the patient because it's not my style. I do always something natural, but in some cases with me, I cannot achieve that result.
True.
So the breast augmentation, let's say, pool of patients will always be there, and I'm always happy to do that. It's one of the surgeries I love to do the most. But this is for another kind of patient. It's just for the empowerment of the women. It's just really for let them feel confident in something which is very mean. Like you go and you have a facial for yourself to feel more beautiful, your skin more glowing, etc. You do this, and it's of course long lasting. And it's such an amazing technology. I'm so happy to be part of that.
And what made you confident that this technology was, a good one, an effective one, and one that will be very successful? Because you joined pretty early.
Yeah, so the company that developed this is a company I'm working with for the other breast implants, traditional augmentation for many years. I know their product, I love their product, and I think they're the best in the market right now. So when they came up 2 years ago with this idea, I said, oh my God, this is absolutely the revolution. I said, I want to stay tuned on that. And then last year, the distributor in UAE signed the agreement with them to have the technology here. And they invited all the plastic surgeons in Dubai to discuss about that. And most of my colleagues said, no, they are too small, they will never work for me. And I said, no, I think the way I'm doing the breast augmentation, the way this can implement my offers to the patient is fantastic. So I work a lot with the distributor here to understand. Now I'm also the part of the advisory board for MIA in the UAE because I'm the one, again, with more experience, and it's really, really amazing. And I think we will see a lot of new details coming up for this.
And you just came back from Barcelona. You mentioned that at the beginning of the episode. Do you want to tell us more about that conference?
Well, the conference was the first worldwide MIA summit. I was a speaker there. I was introducing my techniques, my little details about the procedure itself. And I'm very proud to announce that together with Sarah, my personal assistant, you know very well, we won the prize of the top 3 customer service centers in the world. Because we deliver a very dedicated customer service to the patient itself. So that's very, very important. Plus, and this is a reward also towards you, I was called on the stage as the best communicator on the social media about MIA around the world.
Yes.
So we have a very effective way of communicating about MIA. That was really, really, interesting for me. But it was such an amazing, because the vibe that you see there, and they have this mirror where you have to sign for the visionary, the people, the pioneers, they call it, the pioneers. The people who believe in this for the first moment, and in 10 years from now, they said, I was the first one to do it. Because a lot of doctors will fall for this technique in the years, but we are the first. So we are the pioneers. I signed this mirror. It was absolutely, a nice moment. And the connection with the other doctors and see that other people have the same vision about that, it's absolutely amazing.
Now we have a few minutes left, and I think there's something we didn't say, and we can close on that if you want. Who is a good candidate for this procedure? So if someone is watching and is interested, they can reach out and come for a consultation, but who is this designed for?
So, as I said before, the patient who have a small breast with not a lot of ptosis, so the breast will not be too ptotic, even though they're changing also the indication for that. A patient who didn't have any procedure on the breast before, so the patient has already implants that cannot go under MIA. Patient who want the little enhancement with again a fast recovery, etc. They're scared of general anesthesia because it's done under local anesthesia with sedation. And patient has a little bit of asymmetry, can be corrected with MIA. If it's too much, no, but a little bit it can be corrected. Really, women who don't have the time for the recovery of traditional surgery, they have mothers, full-time workers, school teachers, etc. They need something that in 1 or 2 days bring them completely back to their normal life. One of the example was the worldwide championship of boxing in Costa Rica. She was always thinking, I will do when I finish my career because I cannot do that. And she did it. And 4 days she was on the ring fighting.
Really?
4 days after. This is amazing.
Yeah.
This is amazing. Without any problem, super happy. She wins the testimonial for the MIA campaign, and it's absolutely great.
So this obviously is a great case worldwide, but what about you? What's the best case that you've treated with MIA?
I had the first patient. She came straight from Milan. She did the procedure, and 2 days after she took a plane and flew back to Milan. Another patient came from Russia. The day after, she took a plane, she flew back to Russia. A patient who is a cabin crew. And 5 days after the procedure, she was working on a flight from Dubai to Los Angeles, 16-hour flight, working 5 days after the procedure. That is amazing. With no discomfort, no problem whatsoever. So that's really a revolution.
I think so. Well done.
Thank you.
And since this is your podcast, you finish with your call to action, not me.
Thank you so much for listening to us. There will be more and more videos about MIA Femtech with all details about the single procedure and the candidates, etc. So stay tuned, subscribe, put a like on this video, and I'll see you soon for another episode of my podcast of Beauty Talks with Dr. Matteo Vigo. Because you deserve the best.